Disclaimer: the contents of Studio 151 podcast and the TU Communication Disorders Connection podcast do not represent the views and beliefs of the University of Tulsa and the Mary Kay Chapman Center.
Welcome back to the second episode of TU Communication Disorders Connection. I'm Chloe.
And I'm Sarah. And we have a special guest with us today. Maria Bustos is one of our second-year graduate students in our master's program. She is days, maybe hours away from graduating with her master's degree, which is super exciting. And she's taken some time out of this busy schedule to talk with us today. So the first question I want to ask you, Maria, is why you chose the field of speech pathology.
I was actually saying earlier, I really like this question. I think it's kind of interesting. I started out as I wasn't sure if I wanted to do either nursing or biology, something in the medical field. So I did that for the first couple of years, but then I decided that really wasn't for me, and I took a break from that. And then I happened to go to an appointment for one of my little nephews for his speech therapy. And I saw that and just decided I could see myself doing this. So after that appointment, I actually got on my phone and Googled which universities offer this degree and applied to TU. And I've been loving doing that ever since.
I love that. What a cool story. And so I think one of the things we're talking to Maria about today, which just flows seamlessly into that story, is her research. So part of our master's degree, the requirements for graduation is the students have to do either original research or a systematic review. Either way, there's a research component to the degree. And I'm going to let Maria speak to what she chose as her research study, but it plays into high school students, the public, everyone outside of the field not knowing about our incredible field of speech pathology. And so maybe that one appointment, if Maria hadn't been able to go, could have changed her whole trajectory, which is so wild to think about, but so exciting. And we're glad she found us. She's an awesome clinician. I know her future is super bright. We're excited to see where she goes. But Maria, can you tell us what your research was, what you chose to study?
So I did decide to do original research, and so we know that there's a need in the field to properly assess and treat, people of all ages, of all backgrounds and languages, and there simply really isn't enough. There aren't enough SLPs to meet that need right now, and so it stemmed from, we need to have more people know about the field, people of all backgrounds, and earlier on. So I went to a high school, a large high school here in Oklahoma, and I did a 10-minute presentation, including a PowerPoint, just talking about the profession, things like the scope, why enter the profession, the need for more diverse people, and the participants, the students I did present to, the high school students, were a diverse group, so different cultures, different racial and ethnic backgrounds, and I also did surveys to gauge their interest and knowledge about the profession before and after the presentation.
Were there certain ages that you targeted with this, Maria, or how were the students chosen that you got to present to?
So they were 10th, 11th, and 12th grade students, and I did decide on high school students because of there isn't as much research on recruitment of speech, people for speech, language, and communication sciences and disorders, but one article that I could find regarding it, they did find that students wish they would have learned about it in their junior or, I believe, sophomore year of high school.
Yeah, I think knowing about it sooner also gives students an opportunity to maybe shadow or do some research and find out, because the field is so vast. So even if you find out maybe, like, I don't know the exact circumstance your nephew is getting evaluated, but so maybe your experiences for a young kid with an articulation delay or a language delay, but having that experience and then doing some research, you could find out you can also do swallow studies in a hospital. You can also do cognitive rehab. You can do voice therapy. You can do stuttering. So just having that intro to the field can then open your eyes to really how broad it is.
Yeah, and that's so as part of my research study, we did just a lot of article reviews on any research that is already out there. And what I did find is that there's, public knowledge of the profession is very limited to people thinking that all SLPs or most of what SLPs do is targeting young kids in articulation and in the school setting, which does happen, but it's not the only thing that happens in speech path. And also just media portrayal of speech paths is also largely females in the school setting, so the white females in the school setting with working with young children. So part of the content of this presentation is, one of my slides just focuses on the scope and what working in different settings might look like, whether that be in a hospital or a private practice, things like that. Yeah.
Totally. I was going to add to that. I feel like anytime I talk to anyone about studying speech pathology, they're always like, oh, do you work on R's and L's? So I think that's so special that you are able to educate others and broaden others' knowledge about our fields.
What would you say was and I don't know if you could tell this or in your post survey with the students if you got it, but kind of the biggest like aha moment for the students or the thing that you shared that kind of got their attention?
So there were 6 main components that we looked at after gathering the pre and post survey data. And then, so the thing that sticks out is the 3 main things that did help or increase as a result of the presentation. So first thing is that the students, after the presentation, they knew more about what an SLP does. So like scope of practice, work settings, what they do as far as like treatment, assessment, diagnosis, things like that. And then second, they also knew more about what an SLP major studies. So that's another thing is that, it is a science-based field, and there are like neurology classes and speech science, speech sound science and things like that. So that also increased. And then lastly, really exciting is that interest in a career in the speech language pathology profession also increased after the presentation, which is significant because then this is providing evidence for even just a simple 10-minute presentation to help increase interest in the field.
That's amazing.
Yeah, that's huge. I in fact spoke with somebody recently that said nobody coming out of high school knows that they want to be a speech pathologist, and that hurt my SLP heart a little bit. I want to change that, and so I really admire and appreciate you seeing that need and realizing that just 10 minutes you were able to create an impact and broaden the knowledge of the field with. I mean, if you think about hopefully how sustainable that is, that we can maybe take that on, or in a 10-minute conversation, we talk about elevator pitches, but just constantly sharing about the field so that people are knowing about it, becoming more aware, not only to get more people in the field, absolutely, but also to help get our services out there. And I know, our clinic, we're on a wait list sometimes. Private clinics around Tulsa are on wait lists. Like, we are seeing a ton of people, but I also know we're missing a ton of people who could really benefit from our services.
That's right. And even with my cohort of my classmates, a lot of us didn't even, I personally had no idea that the speech language pathology profession existed up until that appointment with my nephew. And so I'm bilingual. I speak English and Spanish. And I think there's just, even within the Hispanic community, at least, the people, my family and the people that I know, there's even less of a knowledge of the existence of the profession itself. So yeah, I think this is something that can be pretty easily, quickly, and not expensive is not expensive to implement in the community by even whoever that may be, speech language pathologists here in the community, students.
Yeah, I would love to get you in touch with all those college counselors out there in our local high schools. That would be an easy thing to have them share out as well.
Okay, Maria. So as you can tell, both Sarah and I are very excited about your research you've completed, and we look forward to seeing what kind of impact it can continue to make moving forward, um, whether it's expanding on it. But can you tell us a few points that you presented on and that are important for others to use?
So, as a part of my 10-minute presentation, I did have a PowerPoint, like I believe I mentioned. And so I'll just kind of go through the content of that PowerPoint. So my first slide, talking about what speech language pathologists do, covered the ASHA Big Nine. So just kind of to get an overview of the field itself.
Will you tell us those big nine, Maria?
Yes. So we went into the Big Nine and we covered their articulation, fluency, voice and resonance, receptive and expressive language, hearing, swallowing, cognitive aspects of communication, social aspects of communication, and communication modalities, or AAC.
That's a huge field.
Yeah, really, that kind of, I feel like, sets up the overview of how expansive the field really is. And it's more than just, the first one, which is articulation. There's a lot more. Mm-hmm. And then, so the second slide went into work settings, and I did list some of the work settings, not all, but including schools, hospitals, private practices or therapy clinics, nursing homes or SNFs, home health, and also travel. And then my next slide, what might working as an SLP look like, included actually some pictures of what it might look like for an SLP treating people in those different kinds of settings, and not just individually, but also in group therapy as well.
Great point.
And then also how to become a speech language pathologist was the next topic covered. And so I just kind of highlighted, for 4 years of undergraduate or bachelor's degree, and then 2 years of graduate school to get a master's degree, taking the praxis exam, and a clinical fellowship.
And so, one thing I want to interject there is if we are reaching any current undergrad students who aren't in a speech path program at this time, but you're considering it, you can switch if there's still time. Or we have an option called leveling, which is where students who maybe had an undergrad degree in education or nursing, or we've even had students come with mathematic backgrounds, find out about the field a bit later, have their undergrad degree already. They can come and take, it's roughly 24 to 30 hours, depending on what undergrad credits you have, to quote unquote level, and then you are eligible for a master's program in the field. So all hope is not lost if we don't find you in high school, but we do hope that we are spreading the word sooner. So sorry to interrupt, Maria. Tell us more.
So going into some more information on that PowerPoint, my next slide was touching on why choose a career in speech language pathology, and I did include content, some information about average national pay, job security, and just the main, the main thing, which is to help people improve their communication skills and to be more functional and confident communicators. And also getting to work with a diverse patient or client population. Also, next slide, I did start talking about current speech language pathology and ASHA member data, just about, how 91.4% of ASHA members are white, and then the rest are minorities. And going into that, a need for diverse SLPs. So there is a growing diverse general population, and only 8.2% of SLPs speak more than one language. With that said, we need more linguistic, cultural, racial, ethnic diversity. As far as more males in the profession,
yes, absolutely.
Only 3.6% of SLPs are male. And to end, I did have a next steps or learn more slide, just talking about Things they can do if they are interested after hearing the presentation, including mentorship or shadowing opportunities, whether that be shadowing at a university, shadowing at a speech therapy clinic, anywhere like that they can get into, tour schools that offer SLP degrees, and also this is where I touched on what an SLP major studies, including biological sciences, anatomy and physiology, and so forth.
I think this is so amazing because, like, I remember being in high school and uncertain of what field I wanted to go into and having that pressure of trying to make a decision. And having that education provides a like outlook at wow, speech paths have multiple different areas they can go into, and I'm not stuck on the one setting. And I think that would really helped um, with making some decisions earlier in that process.
Yeah, and I know for me, I always said I wanted to be a teacher when I was like through about middle school. I wanted to be a teacher, and then I saw what poor classroom teachers in middle school have to deal with, and I changed to nursing all the way through until all the way through, I guess, until freshman year of high school was when my grandfather had a stroke and I learned about the field of speech path. And to me, it was the perfect blend of the medical side of nursing and the teaching side of education, and allowed me that, as we talked about, the opportunity to be in a hospital, to be in a school, to be in private practice, to do all those things. So,
but again, that was you had that specific exposure to it. So Maria's using this um, education for those people that may not have that exposure early on.
Okay, well, that was incredible information that you shared with those high school students, Maria, and we are just excited to see what's next in your future, and excited to see how we can potentially expand on this groundbreaking research that you started here at the University of Tulsa.
It's been an honor being a grad student with you, Maria, and we appreciate you coming out to take the time to talk to us and share some information.
Yeah, thank you for having me. I'm always more than happy to talk about this and how we can spread more awareness about the field and hopefully get more people interested, to meet the needs of the populations that speech language pathologists serve. So thank you for having me.
For further information or podcast ideas that you'd like to share with us, please reach out at 918 631 2504. You can ask for Chloe or Sarah. We would be happy to chat with you.
Thank you, Studio 151, for letting us record. We look forward to recording future podcasts.
Remember, communication is not just about words. It's about understanding, empathy, and connection. Until next time, keep listening, keep learning, and keep communicating.